Good morning and welcome, everyone. Thank you so much for coming to Integral Care's first community forum of the year. I want to begin with some logistics, which are critical. We have a couple bathrooms right through that door to the left. We have some sandwiches, some chips and drinks that we invite you all to enjoy while we're going through this forum. We'll talk through the logistics of questions. We're going to hold questions till the end and have a QR code or a microphone that you're welcome to stand up. And I want to begin with acknowledging our board chair, Trish Young-Brown, and our other trustee, Reverend Callahan. Thank you for being here. So we'll start off with you have part of our executive leadership team here today, and we'll go through a little bit about the process we embarked on through the strategic plan, what went into developing it. We'll give some background for those of us that don't know us well. Welcome to those of you that are here for the first time. Just describing at a high level who we are at Integral Care and kind of what we do and who we serve. We'll go through, we have 6 pillars of the strategic plan, and we'll go through those in some sufficient detail and then invite questions. This is not live streamed, but we are recording today, and this will be posted on our website if you feel like you want to review it once again or invite friends and loved ones to also view it. I'm Kathleen Casey. I'm the Chief Strategy and Innovation Officer, and I'm very pleased to be here. I'll introduce Jeff Richardson, our CEO.
Thanks. We're going to do quick introductions. So hi, I'm Jeff Richardson. I'm the CEO here. Good to see you all.
Good morning. My name is Dr. Amanda Banks. I serve as the Chief Public Health Officer.
Good afternoon. Dawn Handley, Vice President, Chief Operations Officer.
Good afternoon and morning. I'm covering my bases there. Elizabeth Marrero, the Chief Provider Network and Authority Officer for Integral Care.
Thank you. Rusty Taylor, Chief Financial Officer.
And good morning, everyone. I'm Scott Ruff. I'm the Chief Technology and Administrative Officer.
What a good-looking bunch, huh? So we're going to, we want to go through some information and really spend, since we have just what Kathleen said earlier, this is first of many kind of community engagement activities we're doing. But we're really grateful all of you are here. I think one of the things that I'm gonna first do is just give a little bit of background on us as a local mental health authority and what Integral Care is and kind of what our responsibilities are. And excuse me, I'm gonna Vanna White it back here so you can see it. But really, the local mental health authority and the LIDA for Travis County. One of the things that's very unique that sometimes people get confused about us is that we are a provider, but we also have a role to coordinate and a network authority role, but we also have a wider role in this community. We are a safety net, meaning regardless of ability to pay, we are here for everyone. And we also have an important role as a convener and a collaborator and actually really trying to set the strategy and coordination for behavioral health services across this county. So we are more than just a provider. That's one piece of things, and that really differentiates us from other nonprofits. I'm also losing my voice, which the rest of these guys are delighted about. So please bear with me. Next slide. Well, actually, can you go back there one more time, please? I just want to talk about the mission, which is, we made some changes to the mission, not dramatic, but they're nuanced, but they're important. And I'm going to read it. To support the health and well-being of Travis County residents living with mental health challenges, substance use disorders, and intellectual and developmental disabilities. So important things that we've added and changed to this. Number one, we really identified our focus as Travis County. We do services across the state. We actually our call center covers nearly 56 counties across Texas, but our focus in terms of service area and who we are here for is Travis County, the 1.35 million folks who live in this community. And the other thing that's important to talk about is we're going to use the word well-being a lot, and part of the reason we've included that in our strategy is, we're here not simply to respond to someone's deficits and needs. We're here to help people live satisfying, meaningful lives and be able to add and develop services, not just identify what people's deficits, and we're here to treat that. So our role is wider than simply managing and treating someone in their most challenging days. Next slide. So to give you a sense of who we are, we have about 1,200 employees. Actually, as of yesterday, it was 1,197. So, nearly 5,000 in my speak. But we have 1,200 is a lot of folks, and we have people working 24 hours a day, 7 days a week across the organization. And we have some of our employees are here. They are fabulous, and we have an incredible set of dedicated employees, again, working across Travis County all the time in a variety of settings. The other thing that's really important to know is that we do have a 24/7 helpline, which is if you're ever trying to identify access or where to go, behavioral health is like healthcare in general. You have to kind of know the secret code and handshake to figure out what you need. And so having that helpline service helps us help identify what services may be available, how we can effectively decode those and connect people to the right services. And as I said earlier, we are also the 988 provider, and we're also in the 911 call center. So we have a lot of roles in terms of being able to help direct and connect people to care. And then, the other piece, and I think Elizabeth's role here is really critical in this, is that beyond being a service provider, we also have a network authority role. And that sounds very menacing. We have a network authority role. But really our job is to help, along with the services we provide, ensure that the gaps that are unfilled in our community, that we can network and connect with and create a network of providers who want to deliver care that either we shouldn't or someone can do it much better than us. But again, with all of this, as you'll hear throughout our discussion, we're in a growing community. There's 1.35 million people in this community. There are 300,000 people in 2024 that had a diagnosable mental health need in this community. That's a lot of people. And so we have a huge gap to help all of us fill and meet the needs in this community. Next slide. So I'm not going to go through all of these, but just to give you a sense of some of the functions and services that we provide here. They are traditional health services, from individual psychotherapy to medication management to specialized behavioral health services. One of the other things that we are doing now is we do have an emergency service. You'll hear more about our PES service, which again is a point of identifying if someone is in crisis, what services that person may need. Everything from helping effectuate an inpatient admission to being able to triage and treat someone on the spot. We have police and EMS that we're working closely with that also drop people off at that location and help us link people to care all the time. We also have observation beds there. We have crisis beds, a range of services. And so the other thing when we talk about what we do, it's well beyond the treatment service itself. We do everything from peer supports, where peer supports is a critical ingredient to how we deliver care, to doing a range of human service and social service work, from job assistance, housing support, and social and daily living skills. And again, that's the lubricant that helps people get successful in recovery. Treatment is not sufficient. It's all the other services that we can wrap around someone. Next slide. So again, when we talk about services, we have a range of adult, children, and crisis services that we do for folks with a range of behavioral health needs. And as you all know, someone doesn't come in the door and say, these services, I only need mental health services, but I have developmental needs or crisis needs. We can't keep sending people in different places. We have to provide an integrated capacity to do this, in a well-coordinated one. So I will allow all of you to read what's on that slide, and there'll be a quiz at the end. If you want a sandwich, you have to remember this. Okay? Thank you. Next slide. So one of the things that's also we wanted to highlight, because we do provide in this community, in Travis County, Austin has been very committed to expanding services for unhoused individuals in this community. One of the roles that we really have in this is not just providing treatment, but actually providing the housing services themselves. And so we have right now 290 people through our own supported housing services, and there's a very specific evidence-based treatment model called permanent supported housing, which is one that we feel very strongly about provides best outcomes. So along with that, we have a lot of other things that we do. We provide vouchers and we connect other people to care. We also have some scattered site housing that we own and operate as well. So, and as all of you know, there's more to be done here, right? There's more services, there's more housing, but housing without support, we're not going to be successful. And again, many of the folks that are in our housing are getting a range of other services from us. They may come into our clinic. They may also have been involved in some crisis service at some point in time. And that's intentional. We want to be able to provide whatever that individual needs to help them maintain that success. Next slide. So one of the other things in our community, and particularly folks who have intellectual and developmental disabilities, this is a huge gap in our community, a huge need to expand. I've said this publicly to many people before. I have a son who's autistic, and I know how difficult it is. And I know this community, and I know how to access care, and it's still difficult. We have a huge gap in our community to be able to expand access to services. Some of it is a phenomena of funding. Some of it is phenomena of being able to get the right services for an individual with very complex needs. So all of those things that we need to continue to challenge ourselves, and you'll hear more today about how we intend to do that. Along with our services we provide, this is where our network authority role becomes really, really key. We have a number of contracts, partnerships with folks in our network to actually provide housing and other support services with folks with intellectual and developmental disabilities. You guys still with me? Okay. Again, there'll be a quiz at the end. The sandwiches are over there. So next slide, please. So we alluded to this earlier, but last year we served about 30,000 people. And how many people did I say earlier had a diagnosable mental health need in this community? 300,000, right? There's a little bit of a delta there, right, that we need to work on. And of that, typically only about 56% of the folks actually access care who have behavioral health needs. So there's a lot of room for both us letting people know what's out there, ensuring that we have the right services that meet that individual's needs, that are culturally appropriate, clinically appropriate. There's a lot of things that we have to do to fill that gap. And when we talk about the calls in our community, the 91,000 calls that we got through our call center is significant, but continues to grow. Some of that is people are actually utilizing the service, which is fabulous. It's also showing that there's a huge gap in our community and people who are suffering out there. And that call center has been a critical link to getting people into care and services. The other thing that's, as we said earlier, we're very proud that we had nearly 2,100 people who were unhoused move to housing. That is an incredible number, but it's a tip of the iceberg. And then one of the things that we'd love to share when we have more time is that many of our services aren't just, we have great outcomes, but we also have a very clear return on investment from this community. So a dollar spent actually delivers a range of outcomes that save money, improve clinical outcomes, and overall improve our community both clinically and financially. Next slide. So I'm going to hand it off to Dr. Casey.
Once again, we invite questions at the end. You can either scan the QR code, and the QR code is on every slide in this PowerPoint presentation, and you're also welcome to stand up to the mic when we approach that. So our strategic plan was launched September 1st, and will go for the next 3 years. The planning and development of that strategic plan was very intentional over a 6-month period, and actually a little bit more, that truly engaged our community partners, from our advocacy groups to other stakeholders to many of the organizations I see in this room, our partners at Travis County, at ECHO, at NAMI, at Delmed Department of Psychiatry, and most recently, Connexus, our regional health information exchange. We had elected officials, our mayor, Kirk Watson, our judge, Andy Brown, conducted in-depth interviews about what they wanted from their local mental health authority. We're here today as part of that feedback. A regular cadence of quarterly community forums was something we heard loud and clear. We've done it before. I think we all lost a few steps during COVID and are kind of back, ready to roll up our sleeves and meaningfully engage the community. Next slide. Jeff, it's you.
Do you want me to do this one?
Sure.
All right. Well, again, when we talked about how many people have been through a strategic planning process? How many people were really pumped after they went through the strategic planning process? Oh, come on, nobody? All right, if you kind of, I mean, one of the things that's really important about a strategic plan is it helps us really root in what we value here as a community and an organization, what's important to us, but it also is very intentional, allowing us to focus on some things that we really need to make a priority within our organization. We may have been doing them, but now this helps us create a very intentional focus. And as long as we're talking about it, we're accountable to you and our community to do it. And it also means there are other things that we can't do. So it really helps our team focus. And part of the work that we do with this is, along with this plan, is that we have very specific operational targets and goals that we're working on to accomplish this across the organization. Next slide. So I'm going to go through this first one, and then we're going to hand it down the line, I think. First, one of the things I want to qualify by saying, again, this is a 3-year plan. We're not going to front load and get everything done in year 1. This is a progression of effort. And some of you have seen before in your own plans, the things that are important. But we're going to provide some commentary on each of these and why they're specific to us. When we talk about leadership within our strategic plan, and number one, also, when you hear the word pillar, that doesn't mean this one's the most important, and then the one that Scott's going to talk about is the least important. He'll probably say he's going to talk about is the most important, and the other ones are not as important. But all of these are pillars. They all hold up our strategy. These are all equally valuable to how we do this. So one is not more important than the other. But the first one that I'm talking about is around leadership. And for us, one of the things that I said earlier is that as the local mental health authority, we have a bigger role than simply providing care, right? We want to be able to be a convener. We want to help expand the dialogue and expand the access, talk about the optimal systems of care within behavioral health. So it's a role that we take very seriously, and we want to be more intentional about it in our strategy, how we communicate with others, how do we convey that. That doesn't mean that we're the ones who do all the stuff, we grab all the money, and we keep everyone out of it. This is really about how we can connect and be able to optimize the resources on our community and do as much as we can to coordinate those resources. The other thing that's really important that I didn't say earlier is that we don't have taxing authority. We aren't someone that can go and say, hey, we need some more money, so we're going to see if we can squeeze in some more dollars through property taxing. Our money comes from 200 different sources, 200. And so, if you see Rusty having a nervous twitch in the middle of this, you'll understand why. It is a very complex set of funding sources and streams to be able to get this work done. And not all of them match actually the goal and scale of everything we want to accomplish. So like everyone else, we're trying to do the very best, and we have some intended strategies to build on that. The other part of this, which I'll just add, and then we'll move on to the next pillar, is that this is for us a very new and a very more focused approach than we've had. We're going to be more intentional about collaboration and partnerships. And I'll give you a good example. We just had a meeting about 2 weeks ago with the Central Health Board. And part of that role is to how do we better coordinate what we're doing with Central Health? How do they better coordinate with us around behavioral health? How do we potentiate each of our talents and skills to make sure that we reach as many people with our behavioral health services as possible. Next slide. So when we talk about a continuum of care, and we have a lot, if you have looked at our strategic plan in this area, and then I'm going to hand it off to, I believe, you, Dawn, right? But I think one of the things that's important to know is that we've also started to talk more about what is in that continuum of care that we need to have. And it's everything from prevention services to high-intensity specialized care. And there's very obvious gaps that all of us in the room could go around and say we know what they are. Our goal is to try and fill those and expand that continuum of care, but also use data to identify what that is. And so even if we've identified something, we also now have to work out the really complex work to be able to make sure that we can provide funding and implement or partner with someone who can do it with us. I'm going to hand it off to Dawn.
Thank you, Jeff. Dawn Handley, Chief Operations Officer, Vice President, in case you forgot. For the most important pillar, even though we said we weren't going to prioritize, I'm just going to say that. Just want to share some of the objectives that we'll utilize to kind of reach this pillar. So one is around expanding access to behavioral health care. And how can we do that? Ways we can do that are increasing our workforce capacity, right? So through recruitment, retention strategies, looking at initiatives that can draw folks to integral care and join our team and help us build these pathways to deliver care. We want to improve our intake and referral coordination. That's one of those complicated pathways. How do you get into care? Where do I go? And instead of having it one place, maybe rolling that out into the community, some of which we've already begun to pilot to make it easier for folks. Leverage our network and provider contract folks who are helping us deliver those services for those unique and very specialized services that we wouldn't be providing ourselves, but we want to engage other experts in our community to help us reach those things, something like equine therapy, for instance, although I would totally love to have that in-house. So other ways are streamlining those care pathways through navigation. We want to do everything we can to kind of reduce that fragmentation or perceived fragmentation, right? You're already in a place where you are needing some relief. It's really hard to try to figure out where do I go next, so we want to make that as easy and accessible as possible. Another strategy would be to reduce barriers to care in underserved areas, so kind of reaching out to the eastern side of our community, to the more access in our county instead of just centralized here inside the city. Ways we can do that are through our mobile crisis outreach, through our mobile vans and our clinic vans that you guys have probably heard a little bit about. We also can find ways to utilize telehealth a little differently, not just for physician services, but for counseling services, for meeting with your case manager if that's helpful. And then ensuring that we have a 24/7 rapid response capability for all those crisis services. So not just on the phone through our 988 or our hotline or helpline services, but also through that field response so that we can meet you where you are. We want to look at enhancing services around those individuals that have more complex needs. These are folks that often get caught in between those systems, right? So we want to strengthen that diagnostic and clinical capacity, so identifying the needs of those folks and then being able to identify the partners in the community that can help us serve that individual. Is that inpatient? Is it a special kind of inpatient, right? And then what happens when they're discharged and what's the follow through, and can we connect to that right ongoing services? These can be special populations like individuals who are living with autism, right, and somewhere on the spectrum. I don't think we have enough of those services. There certainly is a shortage around substance use, right? Some of that detox and then ongoing. And these are things that are lifelong. It's not a one-shot kind of one and done service. So we need to make sure that our system of care can meet folks where they are and provide the services that they need when they need them. And then lastly is around data. How are we using data to inform that decision making, looking at those clinical services? Where do we need to expand? Where might we have gaps? What are we doing well? Where can we improve? We want to use that data to help kind of drive and fill those gaps, and then also kind of track the outcomes. How well are we doing? Is it doing the thing we thought it would do? Is it doing the thing that our community thinks it should do? So getting more sophisticated around our use of data and then how we communicate that data that we're collecting. And then some of the strategies that support that are the well-being and community education. Some of you may be more familiar with our either mental health first aid services, so kind of helping educate the community on those signs and symptoms and how you get folks into care. And then strengthening school-based services. We have some school-based services at some of the schools, but how can we expand that? How can we get a counselor in all the schools and meet those kiddos in school where they might be struggling with some of their issues? And then always looking at deepening those roots of recovery and integrated and trauma-informed care.
Thanks, Don. But before you, if you could hand the mic just to Elizabeth, just to kind of talk through a little bit about what the network authority's role in this is.
So you'll hear a lot of collaboration as I'm talking through my goals in my area that we're going to be working on is we want to expand the network. We want to be actively recruiting. We want to work with our existing providers, find out what needs do they have, because some of these are smaller organizations that might not have the internal capacity to do administrative work so that they can be out working with our clients and our referrals. So we want to be able to provide some of that support internally. Also identify areas where people are dropping off. Like we don't make it the easiest to join. It sounds like it's easy. Well, you just expand the network. But we make it pretty rigorous because we want excellent care provided to the populations that we're serving. So, but where can we make it easier for them to, if they're interested, to go through the process and complete all the credentialing and all the requirements that we're asking of them? Are we providing the right support there? And before we even go to expanding it, to Don's point and to Jeff's point, is are we being strategic about it? What is the current gaps? What services are we providing and where? Because geographically, are we in the right places? Are we where our clients live? Are we where they are going to seek support? Are we identifying areas or services that they don't currently have access to but would probably really benefit from it, so that we can be strategic as we're meeting with different partners, potential providers, organizations, smaller individuals and grassroots, so that it's not just your typical large organization that could easily join the network and go through all the application process, so that we are really identifying services like equine therapy, aquatic therapy, camps. Are we providing access to those type of services that our families would really like to have access to and that would really benefit from, so that they can get to that well-being point? And we're not just providing crisis services, that it really expands overall our services in general. And I think we also want to make sure that we are out in the community before, that they're not accessing integral care only at that crisis point or when they really need something. Can we be more preventative and make sure that they know, that the different communities know what services, how they would even access, who they can call for help, how they would even do that. And I think that's been, as someone who's relatively new to integral care, that's really, I see that there is a large need there for people even to know about integral care, and how they would even contact the organization to even access a service, that they don't need to be just in crisis. So I'll give an example. So one of the things that we're looking at is immigrant support initiative. Where we are now, people are having a lot of anxiety. Are our non-English speaking communities, are they comfortable to go to a clinic site? Do we need to increase telehealth services so that they are okay to still connect with somebody if they don't feel comfortable traveling the 15 minutes to a site? So those are the kind of things that we're looking at. And before we even get started down that road, we really need to get an accurate picture of what the overall makeup is of our service providers and where our population and demographics are.
Thanks, Elizabeth. And again, you'll hear throughout this whole conversation strategically, we're going to be spending a lot more time this year trying to get a single source of data for truth about where the gaps are, not doing this in a much more intentional, strategic way. The other thing that Elizabeth said that's important is we are looking at all communities, but also clinical gaps in the service provision that we have, both in prevention services, and if you look at our full strategic plan, and I would urge you to do it, and if you're having difficulty sleeping like I do around 3 a.m., pop it open and look at it, but read it, because we have a very specific approach that we put in here, from everything from prevention to high intensity services. And as it's been noted and many of you have heard, our jail system is way too often the proxy for not good access to more intensive based services, and we want to change that. But it doesn't instantly happen. There has to be both a strategy, a will, and resources to make that happen. And that's why this collaboration piece is so important. Next slide. Oh, there it is. Bam. We don't have the time to go through this now, but I really would urge you to look at that. One of the things that we've highlighted here is there's very specific services, but it also is around governance and coordination of these. So please take a look at this, but just it's very, we tried to highlight the key components that we need to have here in Travis County, and we'll spend more time in future community meetings talking about this, but it is a range of services, but it's also around something that we feel is a service that hasn't been done as well in our community, and we take responsibility for that, is to ensure more effective governance and coordination of these limited resources. So how do we work with all of our partners to ensure we optimize all the resources that are available out there? Next slide. So what a lovely segue into access, which is one of the areas that I think is, as you heard Elizabeth and Dawn talking, one of the things we're going to be starting to look at, and Elizabeth mentioned this, which is, how are we ensuring that everyone has access to care, not just building a building and hoping everyone shows up. You've heard us talking about the mobile clinics that we've developed, but how do we know who we're missing and who we're not accessing? And there are communities that we have to deepen both who we're serving, but also make sure we understand what the needs are. We can't presume to know what everybody needs throughout Travis County. So I'm going to ask Dr. Banks to talk about some of our key strategies.
So when we talk about access, it's more than just providing a phone number or an address and making sure that the people that we serve know where we are. We want to ensure that the people that we serve, that they feel seen, that they feel heard, valued, and respected. And so a part of that is, one, we've created a toolkit. You'll hear about the Bridge Toolkit that ensures that the decisions that we make as an agency, that the community's voice is at the root of all of those decisions. And so the other part of that is that with our staff, we want to ensure that they're trained. You heard Dawn talk about trauma-informed care. As we talk about person-centered care, we want to make sure that the staff understand how, be it housing, justice involved, that all of those things impact an individual's health and how it impacts their health so that we can render more effective services. The other part of that is, when we talk about access, we can't do this work without our partners and without the community. And so when we talk about listening and centering the community's voice, we're going to have listening sessions, more community forums, so that it's not just us it's not Integral Care doing services for the community, but we're rendering services with the community. Did y'all hear me? Did y'all really hear what I said? Not for the community, but with the community. That's what I'm talking about, Colleen, yes. And that is so very important because for so long, we've made decisions and we've not centered the voice of the community. And so, be it zip code, and we can go on and on and on about how different groups are impacted, we want to ensure that the work we're doing is rendering outcomes and access for every person, regardless of where they live, work, play, or worship. And so you're going to see us in the community. You're going to see us with churches, other faith-based organizations, with grassroots organizations to ensure that, once again, the voice of the community is centered in the work that we do.
So we're very concerned about Dr. Banks' enthusiasm. So please see what you can do to help her with that. I mean, I think you'll hear a lot of the things that we're talking about are interconnected. But part of when we talked about strategic planning, part of this is measuring those activities, delivering on that. And Dr. Banks' role and all of our roles in this group is to do more than we have. There's a lot of engagement work that we've done over the years, but this year, we're in the next 3 years, I think we're really trying to up and improve that capability. And I think it's really important when we talk about access. We've talked a lot about, through this whole conversation, about using data and having data-informed strategies around this. And you'll hear throughout all of our conversations how important that is. If you go to the next slide, please. So when we talk about workforce, our HR director couldn't be here, so I'm going to do my best to represent him. But when we talk about workforce, every strategic plan I've ever been involved with has workforce on there. And everyone goes, our workforce is the most important thing that we do. And it sounds like a painful cliche, but 85% of our resources are dedicated to people and the work that we do. You heard we had 1,200 people here. One of the things that we're very proud of is that we have done a lot to target and support our employees over the past couple of years. We have more to do, but we've added, we've improved wages, we've added more benefits, but that's a modest part of the story. We're also really making sure that the folks that are working for us are actually matching the capabilities of what our community needs. And so that has to do with both clinical training, ensuring that people reflect the communities that we serve. It's also really looking at what's happening around us. How many people use ChatGPT on a daily basis? A few of us do. I guarantee you in a few years, when you look at, we were at a conference, or I lurked on a conference, we had some of our staff there. When we looked at an employee list, you're going to see a list in the future with an AI agent as one of the employees working for some of the services. And people get terrified when you talk about that as it relates to our work. We're talking about ways to assist us to do what we do well, which is human contact, not to replace it. Dr. Casey and I last week were in DC, and we met with some of our legislative leaders about this, and immediately that concern gets presented, which is we hear all these horror stories about ChatGPT replacing therapists and what the negative outcomes. That is not our intent at all, but we really do need to emphasize with our staff the most effective ways to utilize these tools that will help us emphasize that, and Scott will talk about that in a moment. The other really important part of that work is high performance, which is, one of the things that we're really looking at is how do we target and optimize some of the structures and systems. We have a lot of regulatory requirements for our work. How many people here love paperwork? Yeah, woo, woo. Nobody. But one of the things that's really important is how can we ensure that we reduce any kind of we improve the high value of that the human contact with that individual, and how do we reduce any kind of things that don't improve value but just add noise to that encounter. So we are training all of our staff in how to use Lean for healthcare, and anyone who's been involved in Lean or process improvement initiatives know what that is. It's really helping people understand how to optimize all of the services we're doing. And that whole process has been around in healthcare for decades. So we have some amazing staff that have been trained in this. We're widening that capacity across all of our workforce. And while that's important, it's helping us manage to ensure that we can reduce some of the challenges. And a great example, as we've rolled out our mobile crisis and our mobile vans, one of the things we looked at is how could we provide more immediate access to psychiatry and treatment services. One of the things that we have to do for many of our services is people have to endure a lot of forms and a lot of processes to be able to get sometimes to see people quickly. And so our team has really tackled that initiative, and it's really helped us to change sort of our intake and admissions process. More to follow on that. I think that's all I want to say for now, but there's a lot of strategies that we're working on with this that go beyond just supporting our employees, which is key, and we need to do more, but also giving them the tools to do their job effectively. Next slide. So I'm going to hand this off to Scott, who's going to talk a little bit about some of the innovations that we're talking about. But innovation covers a lot of things, both clinically and operationally.
Yeah, that's a big word. And Jeff, you stole a little bit of my thunder with some of my chat GPT, but what an exciting time we live in, right, from a technology, but we also live in a little bit of a scary time. And so you hear a lot about intentionality and really being strategic. That's what we're looking at with our technology stack. You know, we do, people trust us with the most sensitive data in their lives, if we think about that. So, though I'll try to talk through, hopefully, talk through some of the technologies we're doing, just know that behind the scenes, we are really looking at the ethics, the privacy, the security. You know, a lot of our partners that we exchange data with, we're all looking at that together to do the best we can to protect this sensitive information. But there's, you know, the last several years, we have really focused on, you know, after COVID, I think every company went through this, where we had some technical debt, where we were a little bit behind on things that we needed to address. And so we've done a lot of the blocking and tackling over the last few years, and now we're to the exciting part, at least to me, where we're going to modernize even greater parts of our organization. A big piece that got left behind for us is administrative tools. And people say, oh, HR system, financial system. Those are key tools for feeding information into our infrastructure for budgets and being able to take on contracts and things like that. So though that's not exciting, it's really necessary. And our tools literally are from the 90s, but we're Rusty's helping me with that right now. We're putting in Workday, and so we're going to see a giant transformation and be able to also have all of that data go in. You know, you heard about getting the right data to the right people to make decisions. That way we're making much more educated decisions throughout our business day. So that's a huge part of our initial rollout. And then for AI, we are really focused on AI with a purpose. I call it shiny object syndrome, right? Everybody runs home. There's a new feature your neighbor tells you about, and people ask me, as a technologist in healthcare, hey, why aren't you doing that? It's like, we're trying to actually start with the problems and then back into what solutions are out there that solves that. And so you'll see that intentionality in our work. And where we started was within our EHR. We're pretty fortunate that I can't call him a partner, our legal counsel's not here, but our collaborative EHR vendor really is at the forefront of using AI and technology.
That's our electronic health record, right?
Electronic health record, thank you. I have to translate some of that. But what's awesome is we're getting tools where we can engage with a client instead of typing on, I think we've all been there no matter where you are, it's like, what are you typing on that screen? We can engage with the client and let the tools behind the scene do transcription. We can do real-time coaching. And these are all assistive technologies. These are not replacements. So when we talk about this, I think it's important to think in that way. We're trying to help the clinicians who are the experts, give them better tools. I don't like the saying do more with less. I came from an industry before this, we did that, and I say do more with better. So that means better tools. They're not, you know, you get the value out of that. And I'm proud to say that Integral Care, we just won a national award for health information technology for value for all of the work that our clinical teams and everybody has helped us with. So that's Awesome. And then you're going to see client-facing tools. You've heard all the challenges. We have people all over this community they could have language barrier, they could have logistical barriers, whatever. We need to break that down. And that's where technology can quite often help. I think many of you may have even seen some of the recent technology where it's doing real-time translation. That could be game-changing to getting people care, especially in crisis. So those are a lot of the types of tools that we'll focus on. And I could go on all day, and I know Jeff would
He could.
stop me, but you'll see a lot more, and we'll be very transparent on what we're doing and why.
Thanks, Scott. And again, the notion of this is, we are not replacing our workforce with robots or providing robot replacement for therapy. But what we're trying to do is really take advantage of ways that we can reduce some of the administrative burden and be able to focus and provide the best tools available to help people get their jobs done and the best experiences we can. Behavioral health in general is probably about 20 years behind the rest of healthcare in terms of what we're doing with this. And we don't have added dollars we need to be able to be the most efficient stewards of the dollars that we have, and we need to take advantage of these resources. And what a lovely segue in talking about our last pillar, which is really around sustainability. And when we talk about sustainability, it's really a combination of things, talking about both our current financial status, but also what are the things that we're doing to further advance both public and private funding and support. Russ, you going to start us off?
So this is as a finance guy, when the finance guy gets up, this is your cue to close your eyes, take a nap. But financial sustainability, for me, let me tell you what I hear. Expense in workforce, expense in clinical stuff, expense in the network authority, expense in infrastructure. So you see all of these dollars coming into play. Jeff mentioned it earlier, as a non-taxing authority, we don't have the ability to raise our own funds, to create efficiencies, to create infrastructure and so forth. So how do you do this in an environment where your funding is flat, but your costs are going up? That is what we're dealing with as a pillar. So what it comes to is, if you got your bingo card, you get to all the business jargon, you get efficiency, you get transparency, you get fiscal responsibility. You get into audits and things of that nature. So we have to be creative in these environments when federal funding is a challenge, state funding is a challenge, county funding is a challenge. When you get to this point, how do we actually, Scott used it, but do more with less? In our case, even how do we do the same at greater cost? It's a difficult puzzle with 200 funding challenges. So we inherently have fundraising plans. If anyone has a penny in their pocket, I'm sure there's some people in the back of the room like Cammie that might take your penny. Got to put that out there. But it's an environment that becomes really challenging. So one of the things we do is when we invest in infrastructure, it's the later ROI, the data around our employees, the data around our services that are realized from the EHR that can hopefully create some of that efficiency and so forth. But we really have got to raise that game. First place, we've got to get the finance HR system up to date. At the end of the day, our funders actually want more transparency. Our community wants more transparency from us, transparency that today our infrastructure doesn't allow us to do. So we have to fix that first, and then use that to review all of our programs and create a way or a methodology for us to then provide greater services. And just to tell you a personal story, despite being a finance guy, back when I was a teenager, I was about 5 minutes away from helping my brother save his best friend. Committed suicide, we were just that late, right? 5 minutes. When I teach my teams about fiscal responsibility, despite being finance and accounting folks, you don't normally hear this. What I'm trying to teach them is the reason you do these analytics, the reason you create efficiencies is so I can go get that next person. I can go save my brother's best friend. Couldn't do it that day. But one of us here has that person. There's somebody out there today that we want to get to. I want to provide the resources for Dawn's clinical team, Elizabeth's network authority, for us to go get to that person 5 minutes sooner. That is my goal as a financial person, which you don't typically hear, but I want you to understand and feel that is what financial sustainability means to me, and the way I want to bring that into what Integral Care does and how we serve our clients.
Thanks, Rusty. And then I'm going to hand it over to Kathleen to talk a little bit more about sort of the other part of our sustainability, both our strategy and some of our other fund and fund development work.
So you've heard today our new mobile clinics, our vans that are out in the community, and how that's been such an opportunity to accelerate this process of innovation and reaching people, and also awareness. We had a potential donor that has become a donor invited to tour the van. And she said, you know, you all are the best kept secret in this community. And we really took that to heart. We know that if people out there, Jeff talked about the epidemiological data. We know, virtually none of us is untouched by mental health, substance use disorders, and other developmental disabilities in our families, among our friends, maybe ourselves. We know we're not reaching everybody, and we need to better communicate and get our name out. I want to acknowledge our Director of Communications, if you'll wave, and the communications team that have done an outstanding job this year in harnessing media opportunities to speak to the community, to speak to people that need our help and engage them in ways to find it. Mental health first aid is an excellent tool. Jeff talked about that continuum of care. The Institute of Medicine has a model that we're anchoring our work in that talks about moving upstream. Promotion, prevention, our partners at the county have let us get the word out with Ask, Listen, Talk, Repeat, engaging people, engaging the community in talking with their kids, talking about the anxiety and depression that we know is on the uptick, especially since COVID. So we're embarking on a very focused plan to refresh our brand, to look at our website, all the communications tools that can engage our stakeholders, family members, and those we aspire to serve. And then in terms of fundraising, I like to quote our good friend Alan Graham with Mobile Loaves and Fishes and Community First Village, that there's infinite bounty out there. We have a very wealthy community here in Austin Travis County. There's a lot of disparity, but there are people who want to give. They just need to know about us. We had a wonderful opportunity at an event last week where people were exceedingly generous. We haven't done that traditionally. We've kind of gone, just a sort of traditional route of, the state, the city, the county, central health, and really have encountered a barrier with people fundamentally not understanding, as Jeff indicated, we are not a taxing authority. We have 200 different funding streams, but they're very narrow in their focus. There's not a lot of flexibility. So we are diving deep into the opportunity to ask people to share their time, treasure if they have it, and talent to help us get the word out and to finance the significant gap in what we need to provide in terms of services and education and what we're funded to do.
So again, I just want to thank, we also did this so you guys could see our whole team that's working on this and all of our staff that are in the audience. This is and all of you, this is an effort that we need everyone to pull in the right direction with. I mean, I have been here a year and a half, and I am so excited about the potential for what we can do and what we've already been able to accomplish since 1967. We've been here. We don't want to be the best kept secret. We want everyone to join us in this, and we want to do this in a very strategic, informed way with a lot of tools that we want to employ and be very focused about. So again, as much fun as that hearing us talk at you, we're also going to go to answering some of your questions, and we'll distribute the answers based on the questions. Do you want to read them?
I will. I want to thank my staff for printing the cards in very large print, because I'm at a point where I said, please make it so I don't have to bring out my electron microscope to read the text. So I invite anyone who wishes to ask questions up at the microphone. We had a few people use the QR codes. Thank you. The first question is, what innovations strengthen the well-being and effectiveness of your employees or your workforce? Jeff, you want to take that on?
Yeah, our workforce is also, there's incredible amount of strain, stress, and burnout that people deal with in doing this work. It's exhaustive, it's challenging, it's stressful, and as you've already heard us talk about, there are more needs than actually resources to match them. So when you, in that kind of environment, it creates an essential challenge and strain. Some of the things that we've done already is that we've added, I talked about this earlier, is that we're going to be starting a process that we're calling it, we call it an optimization project, but really looking at ways to get staff involved to help redesign processes across our system. And it's a ground up, meaning it's not one that I'm sitting and writing on a napkin and saying, make this happen. It's a ground level decision using very specific lean and process improvement initiatives. There's other things that we're very focused on around well-being. We've added more resources to support employees. I think the innovation piece, honestly, is not something that I'm going to be cooking up. The innovation happens with the people doing the work day in and day out and using data to do that. So I think there's a lot in that answer. I think we also spend a lot of time, one of the things we spent over the past year engaging our staff, everything from town halls to our union partners to also our other partners, to make sure we're doing the right thing and we're hearing what we have to say. I'm hearing what people have to say other than simply downloading what I think people want. That's an important process. We have 1,200 employees with a variety of different views and opinions. We want to be supportive and keep people focused on delivering that work the most effective way possible.
So this next question kind of nicely bridges supportive workforce as well. Can you expound on the use of AI in your system of care? We, as Jeff mentioned, we were invited by the Meadows Mental Health Policy Institute last week to be in Washington, D.C., to highlight us as really being at the forefront of incorporating AI and other technology into our system of care. And they were astounded at the percentage of our staff that have welcomed it. As Jeff said, no one goes into the field to do clinical notes. They go into the field to do therapy and engage people. And I want to acknowledge Dawn and invite you to comment on how you were able to have such an incredible uptick in how our clinicians have fully embraced technology to do better work and serve more people.
Yeah, so there was some trepidation at the beginning, right? And so you have your champions, those folks that are just naturally drawn to that, wanting to use technology. What are the new tools? And that's a certain kind of really a skill set that you have, right? And so you get excited about it and you try it. So we have something that we call Bell's AI. It helps with documenting how we do our documentation or our clinical notes from the service we're providing, and then how it connects to the plan of care. So when you come in, you get an assessment, all the things, and then we develop a plan of care. It's kind of the roadmap to your clinical care. And this tool helps cut down on that paperwork, right? It's working with the clinician. It has some ambient listening capabilities, so it can help with creating that note. So you're spending less time writing all the notes. And one of the things, you go to school, Jeff talked about it, nobody wants to write the notes. So you go to school, you learn about all the diagnosis, how do I treat, what are the pathways, and then you're plopped into a job and they're like, here, you have to do these things, right? And much of what we have to do is actually mandated by many of the contracts, and the state being one of them. It's pretty onerous. It's heavy on the documentation. We really can't change that, or like a private entity might do to kind of streamline, so we have to streamline in other ways. So if we know we have to do the thing, what is the tool that can help us do that, where we can free up that clinician and that case manager to be able to spend more of that time working with the client and less of the time writing about what it was they did with the client, right? And then how that ties back to the plan of care on kind of what are the needs and the strengths that individual has in their unique situation, because all of that's unique and everybody's need is different. So having these tools and having the champions who adopt the tool and then go out and tell their peer group, this is a really neat thing, this is super helpful, but you might also have someone go, this is hard, and I didn't get it. And that's fine. So then we're going to mentor, we're going to get someone to work and walk through it with you and spend that time and show you how to do it. And 99.9% of the time, when you give that one-on-one time to individuals, then they get it. I can remember, this is going to date me a minute, way back when email first started. I was like, oh my gosh, what is that? And I had to send an attachment for a state report. I was like, an attachment? How do I get it on there? Like, I wrote it, but how do I do it? So it was scary. So this is like that. It's just a different iteration. But everything is so much more intuitive now. And that's really the work that Scott is doing with the champions on the program side, saying the docs are going, I need it to do this on my prescribing piece, it's not doing that. The clinicians are going, I need it to do this, it's not doing that. And then building that together with the vendor to kind of create the tools that we need, and then kind of track, like, how can we automate some of the work? How do I know if what I'm doing is actually helping improve my client's care? And so those are the tools and the way that we're trying to use innovation and find those champions within the organization, and then letting that energy and creativity just go out throughout the whole system of care.
Okay, next question. What does mental health and well-being look like in practice in Travis County?
Yeah, before we get there, I just want to add on to what Don just said. I remember, I've been in behavioral health services for 40 years. Yes, I started when I was 5, if you're trying to figure out how old I am. And I remember when a computer was first introduced, so it was like over in the corner, and nobody quite knew how to use it. We thought it was important. And look how it's changed our lives. I think we're at that same crossroads with AI and these tools. They will dramatically change how we do things. And I also want to shout out to Connexus, which has been an incredible partner. And one of the things around innovation that's really, really important is how do we share information amongst all the people who are supporting people who need our care in a more coordinated fashion. It's not simply us convening and having meetings. It's actually trying to work off the same song sheet. How can we share information? And so that's a lot of the work that we're going to be doing with Connexus and our other partners here in town to make sure that we can share information, not just on after something's done, but more live data that also protects people's privacy sufficiently, but also widens how people can use data. That is a really big piece of our plan. So I wanted to make sure we didn't lose that in the conversation. And that's very different. If you imagine how many times you've had to go to a different doctor to say what your birthday is and tell your story over and over again, just imagine doing it on your worst day over and over again. And so that's what we're trying to improve upon. In terms of what well-being looks like, tying to what we just talked about, which is how do we eliminate as many barriers to care as we possibly can for people. But when we talk about well-being, if many of you know, our tagline used to be healthy living for everyone, and now we've talked about well-being. We felt like healthy living for everyone was a notable goal, but one that we couldn't activate for our entire community. Mental well-being is. And that goes well beyond eliminating symptoms and feeling better. It's being productive, having a job, having a sense of community, having friends, being able to live a satisfying, meaningful life on your terms. In terms of measuring that, that's part of what we're going to be doing too. It's simply not symptom reduction, but how do people live more satisfying, meaningful lives? As we noted earlier, there's 300,000 people in our community that have a mental illness. There's about 77,000 that have a severe mental illness. And again, all of what we're looking to do is not one size fits all, as you heard Dr. Banks talking about specifically. We really have a lot of work to do to ask people what that means and not assume we know.
Next question, I can invite any of my esteemed colleagues to weigh in here. How can integral care gather meaningful community input?
I think one way is your attendance at our community forums, at our listening sessions, but also if you have ideas, you can contact any of us to offer those ideas. I won't speak for any of them, but if you want a one-on-one, we can do that too. you buy. I'm joking, but but we really can do a one-on-one because I think it's those relationships, and so the more that we're able to nurture and foster those relationships, the more apt the communication is to go two-way, not one way, but two-way. And so you'll hear more about those listening sessions, about the community forums, discussion boards. And so if anyone else wants to add, and if you want to talk even after this, we can do that too. Or if you want to set up some time, we can do that as well. Thank you.
I'll just say also, I think engagement looks different to a lot of people, and you really have to put yourself out there. And I think that's one of the things, and there's a lot of willingness from this leadership to go to events, even if people, you may not talk to a particular leader of an organization or a community group, but making sure your presence is there. And people slowly, it takes a long time to build those relationships. It doesn't just happen just like, hey, we want to, which is great, but you've got to really put some effort to engage those different communities at how they want to get engaged, what works for those communities, what works for different folks. So I think there is a strong willingness amongst this group to all of us to really make sure that we are out there and trying to connect with folks.
Next question. What is this cultural socioeconomic mix of the people you serve? Again, I invite input, but I will say what we know very clearly is that severe mental illness takes an incredible toll on your ability to sustain meaningful work and have an income. The vast majority of the people that we serve have no funding source whatsoever. And we have made great strides in engaging folks in meaningful work and attaching them, but when they first come into our services, we know we're not a Medicaid expansion state. We have primarily unfunded folks. 1 in 5 individuals that walk through our doors or who we outreach under bridges, in encampments, wherever they may be, do not have a safe and stable place to live. 1 in 5 of the 30,000 or more folks that we serve. In terms of demographics, we know on a regular basis overall that we generally mirror the population of Travis County. But we dig in, I know that can vary by different kinds of programs, so we are scrutinizing that. Dr. Banks, I know you've done a lot of work in this area, if you have anything to add. No? Okay, great. This is an interesting one. How is social media important for people seeking support?
First off, follow us on every social media platform that you use, and put that plug in, and then pass it on to others. I think it's critical, and I think one of the things you have to remember when we talk about our role as an LMHA is that we have a public health role, and part of the way to address that is to let people know how to access care, what it looks like when someone recovers, and I'd love to think that if we put on a 30-minute infomercial on TV, everyone would sit in front and watch it. But most our community social media is very much part of our fiber, and it's part of our public health strategy. Dr. Casey talked about this earlier, but as we look at what we're branding and building in our website, we're also going to be further expanding on our social media presence. And so if you have feedback on how that's going or ideas, please let us know. But it is an absolute critical component of who we are. And our social media guru is in the back, Kelly, who's actually does an amazing job about keeping us together and organized. But it's also a role that we all play with this. And I'm asking everyone in this room to make sure that when you get information from us, not to promote the organization, but promote that mental health is effective. If we treat people and letting people know about how to advocate for care and services. Because as I said earlier, we're not here blowing sunshine that everything's great. We have an enormous amount of working gaps in services. And we need everyone in here to help support the value of behavioral health services in our community.
Would anyone like to ask additional questions at all?
Oh, that was it? Oh.
Yeah, we have one more, and I think that we probably touched on it, but can be more explicit. What are the promotional goals for integral care? Number one, we're promoting our new strategic plan, and our goal is to not remain as the best kept secret in this community. I talked about redesigning our website, refreshing our brand. We have taken an evidence-based approach to our messaging. Believe it or not, there's a whole science around words and phrases and how you engage people as opposed to alienating them. You know, very well-intentioned people can use vocabulary that others, folks, especially those with mental illness and other kinds of disabilities, inadvertently doing so. And we want to lead and model to use terms like our neighbors who are unhoused instead of not for person-centered language, the homeless, that others, individuals. So embracing our messaging and communicating that out is one very valuable goal. You want to add to any of that, Jeff? What we want to promote?
Yeah, I mean, I just want to also urge everyone to look at the strategic plan. We didn't do it justice to go through all of our strategies, but please take a look at that.
We have a one-pager at the table.
Do you want us to add something? Say that again? Oh, yes. There's a lot of things that we want to do, and I'm going to ask Dr. Banks to put a plug in for our partnership with our conference.
So speaking to the cultural, socioeconomic question, we know that people of color are more likely to be impacted in terms of disparate outcomes. Integral Care is proud to host, which will be the 26th Central Texas African American Family Support Conference. And the goal, the purpose of this conference is to bring awareness to mental health challenges that the African American community faces. And so this is one way that we work to reduce those barriers and raise awareness. And so be looking for that date, and we would love to see your face in the place, which will be Greater Mount Zion. I don't have the address for you, but there will be more information. And hear me, this is not just an African American conference, okay? This is for anyone who works with, knows of. It's for everybody. And so we would love to see you. We have record numbers each year. Y'all hear me? We break records every year. And this is one conference across the country. This is the one conference across the country that is geared towards mental health for the African American community. And so we would love to see you. And you'll hear more about it. So thank you.
Thanks, Amanda. And I know we're running out of time, but do we have time for any more, if anybody has any questions? Yeah.
So I'm not going to go to the microphone. You spoke to the number of people that were housed in last year, 2,169. Can you just speak to how that came about? Of course, integral care was a huge part of that, but you're not an island, right? And those people required more than just services from integral care. Can you just speak to the collaborative nature of that work that's happening in our community? Because I don't know that that's well understood.
Yeah, that's a great question. And many of the folks that we served actually are experiencing homelessness. And so for some of these individuals, there's been an intersection with the criminal justice system, right? And we know those are barriers to housing. It's harder to get a voucher. It's harder for a landlord. It disqualifies you for some of the help that you need. So some of the work that we've done is around providing the behavioral health care, but we actually look at housing as a health care intervention, right? So if you don't have your basic needs met, if you don't have a place place to live, then it's really hard to focus on your recovery. So working with the city and the county and our other housing partners, we were the forming partner with like Caritas and SAFE and LifeWorks and A New Entry and Urban League and SAFE and us formed the Travis County Supported Housing Collaborative and approached the county around funding this collaborative and the partners in the collaborative to bring more of the housing on for the clients that we serve, for the folks that have these complex needs, and to provide that permanent supported housing for these individuals. And they generously awarded each of the members in the collaborative are a part of that. And so we thank the county immensely for that support, and working with the city as well, because this was in our instance with Seabrook, and this is Marlene's in the audience and she leads this work for us. With Seabrook is kind of leveraging kind of what are the property around the housing corporation that had the property, and then how did we connect ourselves to a larger affordable housing unit, and then have PSH as a part of that. So just being creative around what are the opportunities and who we can partner with. So we meet with the city. We're a part of the Downtown Austin Community Business Group with Bill Bryce and his team. We're going out with our EMS and first responder partners and trying to meet with those individuals who haven't quite found their way to the shelter yet, and then moving them into that, working with the county on the diversion center. So we've got this pilot in Central Health, and the city. So we're in a building that the city owns. We're getting funding from the county and Central Health and using some of our state dollars to provide this integrated care, so there's like no wrong door, regardless of what your need is, bringing you into the system, being able to hold on to you longer, and stabilize those symptoms so that we can find housing for you so you're discharged to a place to live, which is, instrumental in that recovery. So those are, there's a lot of things happening in Austin right now, and there's a lot of people doing a lot of work and leveraging all of the levers that we have to engage with our partners. Central Health is doing a lot of work in doing mobile teams with us, and community care, going out to these various new developments that are coming up and bringing that care to them. So there's all across that spectrum. It's not just a one way to deliver that care and to help people maintain their housing. It's one thing to get them housing, but then how do you stabilize them and sustain them? So it's those supports and bringing that care and making sure that they're healthy and have the opportunity.
Thanks, Don. And again, I think that was a great question, but it's a loaded one, Trish, which is that there's a huge amount of work that happens around housing to help people maintain their housing. And there are people that, frankly, need more supports than they're able to get in housing. As we said earlier, nearly 30% of the folks, and probably more in the jail, are struggling with a severe mental illness. And that's becoming a proxy for more intensive residential and access to inpatient care that we need to tackle in this community. And it's part of the work that we're doing. But one of the things we want to do is maintain the progress we've had. So to do that, we need to make sure that people are getting the supports so they don't have a disruption in their housing. And that means all the things we just described that we're doing in all of our partners. Housing is not enough. It's just the tip of the iceberg. And if you heard Mayor Watson talk, actually, he did an interview yesterday where there's been some efforts by the state to eliminate some encampments we've had around here. And he was very clear that you can eliminate the encampment, but you don't eliminate the problem, which is, this is a policy challenge, not a person challenge. And we do need to do more to address access for everyone at whatever level they need it. Other questions folks have? Yeah.
First of all, just thank you all. This is so informative and helpful. So I'm glad you're doing these community forums. My question is about when you say you're the best kept secret, what does that mean about your services? So things like the mobile van, does that mean they're not at full utilization? Are there other services that you offer that are not at full utilization? It would be helpful to better understand that.
Yeah, I'll start, and if anyone wants to add to this, when we talk about it being the best kept secret, it's meaning that there's so much about people's stigma associated with accessing behavioral health services, where it's not something that's publicly talked about. And we also haven't done we have more work to do to make sure that everybody knows what services they can access in our community, because it's not always clear. It's very complicated on getting access to care. And so I think most of our services, the utilization is really good. But part of what I said earlier is that, there's a group of folks that we're not meeting their need right now. And so we need to be able to get the word out. We also need to work with policymakers and advocates to really focus and align where those gaps are to make sure that those are being met. And that's when we started this conversation today about our role as a convener and partners with others. We take it really seriously. I think utilization is really high, but part of what there are gaps in both who's getting services and the type of services someone's getting. And we want to be able to do that in the most precise, data-informed way possible.
So I would just add a couple of things to that. Is it's really hard to kind of say all the things we do, and I think that's part of the secret. What is an LMHA? What does integral care do? It's not one thing, it's 250 things wrapped in. It's actually probably exponentially larger than that, because there's like 1,000 metrics to each contract that we have to do. I'm pointing at the county because the diversion project is enormous in the data that we're gathering and tracking, but it's really important because it goes across so many large systems, from the law enforcement system, so things APD has to do, the things the sheriff's deputy has to do, the things the county attorney's office has to do, how we have to do, the things central health and community care have to do. So it's all of the things. And so that's part of what it's hard to really explain, all the nuances. So the one thing, I would like you to take away from today, if you take one thing away, it's that what we're striving for is there is no wrong door to care. There's no wrong, right? And so what does that mean? If there's so many doors, how do I know where to go? Call the call center. That's what we're for. You tell us what you need. We're going to share all those secrets and connect you to the thing that meets your need.
We were actually going to play bingo. If we threw an acronym, we'll have a little board to toss at you. Our space, there's secret handshakes and codes that make it very difficult to access care that we want. I think Don's point about call us and we'll help you work it through. We're out of time, but I want to just thank all of you for being here today. I know you have a lot of other choices in how you could spend, even though the sandwiches look lovely. But we really appreciate your interest. We're also going to ask for your dedication to help us meet this mission. And so I just want to thank all of you for being here, and then just thank this amazing team who put this together. So thank you all. And we'll be around if you have any questions. Thank you very much. And thank you, Dr. Casey, for keeping us straight.